Hello, I'm glad to see you on the Healthy Movement channel where we talk all about back and joint health. My name is Daria. I am a leading specialist at the Healthy Movement Kinesitherapy Center. And today, we will get rid of buttock pain, pulling pain in the leg, which can spread to the lower back and also prevent the development of coxarthrosis and sciatic nerve entrapment. To do this, we'll work on just one muscle. Which one do you think? Write in the comments. In the meantime, I want to remind you that in our center, we help to solve any problems with the musculoskeletal system. So come to us, we will do our best to help you. Our centers are located in Europe and Dubai. So the most common muscle that provokes pain in the buttock is called the piriformis. It is located under the gluteus maximus and near our sciatic nerve. When the muscle goes into hypertonicity, which means it becomes more tense, it can irritate the sciatic nerve, and as a result, we will experience different types of pain. It can be a pulling pain down the leg up to the shin, numbness in the fingers, pain in the lower back, or localized pain in the buttock itself. Most often, this pain goes away when you lie down a little, meaning you rest in a horizontal position. But to get rid of this problem, we need to work this muscle very well, which we will do with you now. So let's start. Beginning with self-massage of the piriformis muscle using a ball. We will place it under the piriformis muscle, which is located in this area. And then we put our weight on this ball and begin to massage it with gentle, slow movements. You may feel pain, and it is precisely on these painful sensations that you need to stop and concentrate a little. Over time, this pain will become less and less, and it will be a sign that the muscle is relaxing. We'll do this for about 5 to 7 minutes. That will be enough. After doing one side, we will move to another one. We'll do a good stretch with these gentle movements. If it is very painful for you to do this, you can do it against a wall first. You can also lean against the wall and do the same thing. Since the piriformis muscle is responsible for abducting the leg and turning the hip outward, this is what we will do. Lift the leg, turn it outward, and return to the starting position. Don't forget about breathing. Take a breath in and out. Lift, turn, and put it back down again. If it is difficult to keep the leg in its natural position, it will not be a problem if we bend it at the knee. And the same, lift, turn outward, return to the starting position. You should feel the maximum tension in this area. Do it 15 times. Do you feel the tension? I feel it very well. And a little more. When you feel that the piriformis muscle is already warmed up well, it means that you are doing the exercise correctly and you can move on to the second leg. Do it about 15 to 20 times. Good. Take a sip of water and proceed to the last exercise. The last exercise we are going to do is the stretching of the piriformis muscle, in this case of the right leg. One leg is straight, the other leg is placed as if in the shape of a 4. And now we will gradually bend and straighten the left leg. The right leg in this case will be completely relaxed and you will feel a stretch just in the area of the piriformis muscle. Here we go. The knee should not turn inward, it should always be tilted downwards. This is very important. perform the exercise 15 to 20 times as well. Can you feel the stretch? I feel it very well. Each person can have their range of motion. If it's up to this level and you already feel a strain, it's okay. It's just that over time, this amplitude will increase gradually. And the last thing, we will stretch the same muscle but in a more passive state. We bend the leg and start pulling the knee away from you. Try to pull the knee towards the floor. If you don't feel a stretch, you can pull your leg even closer. That's it. Now I feel it well. Again, everyone may have their amplitude. Don't be discouraged if you can't throw your leg that high, but over time this amplitude should increase. And stretch it well, once, and hold it. This is more of a passive stretch. Great, well done, you did it. And we will do the same for the other leg. Dear friends, I hope you found this episode useful. I would appreciate your comments and reactions below this video. Be sure to save it, watch it regularly, share it with your friends, and subscribe to our channel so you don't miss even more useful videos for your health. See you soon and stay healthy.
Hello. I came here with the background that I have scoliosis and Scheuermann and had the usual complaints about my back, about my shoulders from sitting all the time in the office chair and being not mobilized enough with my back and especially with my cervical spine. I exercise now since a little bit more than 1 month. It's now my 14th session, so actually my program is 3 sessions per week. And I do not feel, I also look much better because my posture improved massively. This is also frequently being proven with photographs and analytics, and I feel really good. So otherwise I would not have continued after my first month. I think the most special thing of this center is that everyone, really everyone here has a high qualification and really knows what they are doing on the one hand, and on the other hand that they have a very, very strong ethos really to go with a patient, to work with you really one-on-one, and that very intensively and extremely engaged. Definitely not only could you, I do intensively, and I try also to convince many people who have the same problems like I have that this is a very efficient, also time-saving method really to reach a fitness and a muscle level which helps you over the entire day. I can definitely recommend Healthy Movement Kinesitherapy Center, of course.